Good morning, Thursday, January 23rd, 2025. I'm Dr. Deuk, CEO and founder at Deuk Spine Institute. Our patient travels from Chicago to Florida. He's had numerous back surgeries, and his case illustrates all the problems with spine surgery today. If you look at his x-ray lateral, you can see on the lumbar spine, lower back, he's had fusion done at L5-S1. He's got screws in there. He's also got a cage at L4-5. And he has an artificial disc placed at L3-4. Now he has adjacent segment disease at L2-3, and he's got a herniation at L3-4 right there behind the cage that's pushing on his nerves. So, why does he illustrate all the problems? Number one, you go to these doctors, you trust them to cure your back pain. Instead, they do multiple procedures over years. They take money from your insurance company, money from you. They leave you in pain, a lot of times worse pain than before, and they don't fix your problem. At Deuk Spine, we fix problems, and we do it without screws, without cages, without metal discs. We don't get adjacent segment disease because we're not fusing, we're not changing the biomechanics of the spine. We're going in and repairing the back of the disc where 85% of back pain comes from, or we're fixing the facet joint, or we're fixing the SI joint. In his case, he's developed adjacent segment disease above his fusion at L2-3. He's developed adjacent segment disease above his artificial disc, which is at L3-4. And he also has a complication because the surgeon did not take out all the disc material behind the disc before they put the disc in, and that's resulted in pushing disc material backwards where the nerves are and crushing the nerve. He also has adjacent segment disease below his fusion. He has a fusion at L5-S1. He has a sacroiliac joint pain on both sides. We're going to fix that today with our Deuk plasma rhizotomy. So today's surgery is going to be titled Complications of Artificial Disc Surgery or Total Disc Replacement and Fusion that are corrected at Deuk Spine Institute. Now, the best thing to do is to avoid these invasive surgeries to begin with. You can see the big scar here. We're going to get started. First thing we're going to do today, we're going to repair the two discs, the adjacent segment disease at L2-3 on the left, crushing the nerve root, and we're going to injection. We're going to try to get rid of the herniation behind the disc, the artificial disc that's there. All right, without doing open surgery. We're going to do that arthroscopically, endoscopically with laser. All right, let's get started. If you have questions, type them in the dialog box. We are live streaming surgery today on Facebook, X, LinkedIn, and YouTube, and probably a few more platforms as well.
Of course, and we got a few more coming our way in the next month or so.
All right, so the first thing I've got to do is place a needle. You can see the needle there. It looks like it's in perfect position for the L2-3 and L3-4, which are our targets. We're going to do some injection of numbing medicine. Our patient is sedated with propofol sedation, so we call this twilight anesthesia. Shot. Beautiful. He is from Chicago, Illinois, or outside of Chicago maybe. But he traveled here because he's tired of living in pain. He has back pain. He's had obviously multiple treatments. And the doctors where he lives can't fix him. All they can do is treat him. We don't want to treat patients at Deuk Spine. We want to fix them. We want to get rid of their pain. So he's got numerous sources of pain. That looks good. Might need to be a little bit more. All right, there we go, shot. Let's get an AP view. I'm going to be talking to my team. We need to use the x-ray to guide our trajectory and our final location with the needle. All right, so I'm hitting the transverse process. That's the TP of L3. I need to be, it's not bad actually. Let's take a look, shot. You guys see the artificial disc on that view?
Yes, we do.
Just need to be a little more medial, shot. That looks good, shot. My trajectory looks really good. Let's see, shot. Getting closer. I'm happy with this. I feel scar tissue from his prior surgeries, lots of it. AP. All right, so you can see the artificial disc, the cage, and the screws on the lateral view, x-ray. Now we're going to look at the AP view. We're going to look at the same metal. And there it is. All right, so show us the screws. By the way, those screws are broken. Jordan, show us the broken screws in the sacrum. That's from his fusion. See those broken screws? That's from his fusion.
Yes,
Now,
we do.
show the halo around the screw on the left. You can see a halo around the screw on the left. Not there. Just follow the shaft of the screw down. There's a lucency, a whiteness right there. Yes, that's correct. All the way around. So that's a loose screw. He must have developed loose screws. They went in and refused them. Look at the bone mass on the side there. All that bone that shouldn't be there. A huge mass of bone. Show that whole mass of bone going up by the cage. That's it. Look at all that. And it's arthritis and bone mass. Terrible. This is what these surgeons are doing to inside your body. Show us the cages at L45. 2 cages packed with bone graft. Show us the artificial disc. Look at this artificial disc, folks. Looks like 2 flying saucers. But look at it. It doesn't look straight, does it? It's already moved. I hate artificial discs. We don't put them in anymore. They are garbage. You don't need them. The Deuk laser disc repair fixes these problems. And that's probably why he's got problems in the back of his disc, because they didn't do the surgery properly. All right, let's go back to my lateral view. All right, so we are a little bit medial. I want to correct and be a little bit more lateral. Sean? That's better. How is he doing? All right, so you can see the needle is at the back. We're touching the herniation at L23 on the left. I'm pretty happy with that. Let's go back to an AP view. You use the AP and lateral, that's a front, back, and lateral side-to-side projection of the X-ray to guide the surgery with Deuk laser disc repair. We are performing true endoscopic surgery, by the way. We are the only true endoscopic surgeons in the United States. In the rest of the world, they do biportal endoscopy, which is not good. They're making 2 holes. We make 1. Safer and better for the patient. Sean, any questions?
At this moment, no current questions.
All right. Let's show our audience, Henry, the 30 causes of back pain that we know about. The 30 most common causes of back pain. And it's important when you're getting treatment from your doctor that you make sure you get an accurate diagnosis, because without an accurate diagnosis, they're going to be probably treating the wrong thing. It's very difficult. Let's have the knife back. It's very difficult to make the right diagnosis of back pain. It takes a very, very well-educated and experienced surgeon. And education alone is not enough. I came out of neurosurgery training not knowing all the causes of back pain. I had to learn them. And I learned them through my patients and through trial and error over the years, and from other doctors who helped me. All right, let's see. Go ahead and show our audience the 30 causes of back pain while we finish getting access.
Copy that.
I'm Dr. R. Deuk Machen with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deuk Majan. Thanks for joining us. Welcome back. You want me to wait, right? Okay. So while you guys were watching our video animation on the 30 most common causes of back pain, which account, by the way, for basically 99.9% of back pain, we did a discogram to test the two discs, L23, L34. Remember, the L23 is adjacent segment disease because he had an artificial disc put in at L34. Now he's got an adjacent segment disease that's painful, L23. We're fixing L23 today. He had 8 out of 10 pain, which was concordant, meaning it's his typical daily back pain that he gets. We tested L34, which is the artificial disc. Remember, the artificial disc was done to take away back pain. He still has back pain at L34. It was an 8 out of 10. You can see on the x-ray, show us the x-ray there, Jordan. You can see the dye inside the artificial disc, and you can see the herniation sticking out backwards. It's like a loop. Show them the herniation. Yeah, that's it. All right, so we're going to go in there and fix that as well. But right now we're waiting for our anesthesiologist to put our patient asleep so that we can do his surgery. How are we doing, Dr. B? Okay. Ready to go? Any questions from our audience?
No current questions, but we do have a few comments.
Sean?
This first one coming from Grant on Facebook.
All right, Grant, take your comment.
Saying, I can't stay, but I am watched this morning, but this is quite intriguing. Have a great procedure. See you,
Thank you, Grant. Thank you so much. Have a great day. You can watch it later tonight. It will be recorded. Shot and available on YouTube or whatever platform you're watching from.
Next comment is just saying thank you from the showing the 30 causes of back pain coming from Audio Artisan on YouTube.
Oh, you're welcome. Yeah, we find that that's a very helpful animation, yes. All right.
And at this moment, no current questions.
Yep. All right. So Henry, let's show our audience the Deuk laser disc repair is done to fix disc problems,
Correct.
like discogenic back pain, like this patient actually has. Let's show the audience the cause of disc pain when people have an injury to their disc in their lower back. How does that cause back pain?
Copy that.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, welcome back. Now you can see that it's inflammation happening in the back of the disc in a small tear, and that's what we fix with Deuk laser disc repair. We're the first in the world to do it. Nobody else does it. We're the first to publish it. Now, other surgeons may be copying what we're doing, which I hope they are, so they can help people like this patient who suffer from discogenic back pain. He also has other causes of pain, including the facet joints and the SI joints. So let's just show the audience all the causes of his back pain as we are getting our tube into the L23.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. So you can see from our videos that the disc is not the only cause of back pain, but it is the most important and by far the most common. The disc accounts for 85% of chronic back pain. It's fixed with our laser surgery, and it's a permanent fix, by the way. The facet joints, on the other hand, are a very important secondary cause of back pain. By the way, these are all pieces of herniation I'm taking out at L23, the blue stuff, okay? I'm grabbing as many pieces as I can because what I've done when I place the dilator through the tear in the back of the disc to get the tube in, I actually pushed the herniation back into the disc, so I just grabbed out the pieces of herniation. There's still some more. We're going to get those in a moment. If you have questions, feel free to type them up. I can answer them for you. Our patient is now stable, doing well. I'm going to improve the focus on this, and then we'll get going. It is very cold in Florida today. We're having a cold wave. I think the whole east side of the country is having a cold wave, right? They're having snow in areas that normally never snow. And we're not snowing here, but we're pretty dang close.
It's snowing up in around Pensacola and Tallahassee.
Wow.
It's crazy.
So it is snowing in Florida.
It is, yeah, a little bit.
It's just not snowing where we are.
Nope.
Thank God.
Yeah. Thank God for that.
All right, you can see we are right outside the disc here at the back where the herniation is, and you can see the pink material. That is the inflammatory tissue. This is all herniation. The gold stuff is calcification of the material, the disc material, the herniation, and the annulus. And you get calcification when you have chronic inflammatory disease. So basically, the tear allows the nuclear material to escape. once the nuclear material gets stuck inside the tear, it creates an inflammatory response. That inflammatory response is the cause of discogenic back pain. And that's what we're treating right now. We're going to be treating his facet joints next. That will be a separate stream. We're going to finish these 2 discs, then we're going to stream the... Look at that herniation right there. You see that?
Yes,
right
we do.
there. Oh, there it goes. It just came out. Okay, that was stuck within the annulus, the tear in the annulus. That's exactly what I've been talking about. There's a name for that kind of herniation. Nobody talks about it. It's called interposed, interposed, I-N-T-E-R-P-O-S-E-D herniation. Can you write that in the chat box? Interposed herniation.
Not a word.
All right, this is a special case because this poor man has suffered and suffered and suffered with back pain for many years, and he's had all the wrong surgeries being done. Fusion, artificial disc, laminectomy, discectomy, and they were teeing him up for more treatments that were not going to work. He came to Deuk Spine because he believes in our advanced technology and treatments. We made a diagnosis through an MRI review. It was a free MRI review. Anybody can have a free MRI review for their back pain or neck pain. I do the MRI review with the patients, and it's all done from the comfort of your home or your car or your work, whatever you prefer. We do it usually on Wednesdays and Fridays. So if you're interested in getting a diagnosis from us, then we can do a diagnosis, okay? And we can give you a recommended treatment based on your diagnosis. Happy to do that. Henry will put the free MRI review link in our dialog box.
Oh, we did? Yep.
For those of you who haven't watched too many of these surgeries, we are inside the disc, at the back of the disc, right where the tear is. This is the most painful part. You can start to see the epidural fat there at 12 o'clock, still some inflammatory tissue. This is all herniation and inflammatory tissue here. We want to get rid of as much of this as we can, safely. Now this is what was pinching his nerves as well. And next we're going to go down to L34 where he had an artificial disc. That's going to be pretty cool because you're going to actually see the artificial disc sitting inside his disc. That's something that even the surgeons can't see that put it in because they don't have endoscopic technology. We do. All right. Just about done with this disc. And then we're going to head over to the next one, which is L34. If you have questions, happy to take them, but this is a perfect example of why you do not want fusion done, why you don't want artificial disc put in, why you don't want any invasive surgery like laminectomy. Answer, it doesn't work, and you're going to keep coming back, giving the surgeon more business as they do more surgery to try to fix the next thing that goes wrong as a result of their prior surgery. All right. Any questions?
Yes, we have a couple questions. First one coming from Betty on YouTube.
Betty, welcome to our live stream.
Asking, just wondering if your movie came out.
Oh, great question. Yeah, I keep calling my director. His name is Jeff. He is over in California. He said that they're doing the final sound mixing, that's exactly what it's called, sound mixing. And Betty, thanks for asking. Sound mixing, I'm learning all this because it's my first movie. Sound mixing it's quite interesting since Betty brought it up. When you make a movie, you have what are called sound scores, and they're different sound scores. So you might think that when they're shooting the movie with a camera, they have a boom and they're recording the sound, which they are. But in the old days when they shot movies, they had sophisticated sound equipment recording sound at the time that they shot the actual video. So you had video and sound together. But modern movie making is very different. And they do not shoot the sound that they put in the movie at the same time they shoot the video. So shooting the video is easy. We already did that over the summer in June and July. And now they are taking all the sounds and they're mixing them together so that they line up properly with the actual video. And that's apparently what takes the most time in movie making today. So what they have is they have the actors and actresses' voice. That is a separate sound bite. Then they have the they have the background noise or sounds, you know, like people talking in the background and things like that. So background sound. Then they have a score, which is your music, you know, the music score that goes along with the scenes, and that is another third. And then they have one more, which is, I forgot what the fourth one is exactly, maybe Henry knows, but they've got to basically synchronize the music with the voices of the actors and actresses with the movement of their lips, so that it all matches, and the background noise, so it all matches, and that it all has to be the right volume too. So it has to be synchronized. These four sound files plus the volume of each one has to be synchronized and edited to fit the video side, so the viewer, the watcher, gets a nice experience. So that takes months and months and months, and that's what they're working on. It's the last step in the movie, and so that should be done hopefully. I'm being told it's going to be done within the next week or two. And then we got to go to market with the movie. We got to try to basically get one of the streamers to buy it and put it on their channel, which we're hoping it will be Netflix, but you never know. So we'll see. Great. Thanks for asking. It's almost done. We're in the final stages of sound editing.
And then, well, the last thing for sound is also the mixing of it, adding like echoes, ambience.
That's what I'm talking about, ambience. Okay, so that's the fourth component. So you got the voices of the actors and actresses, and then you got the sound effects, you've got the music score, and you got the background. So
exactly.
Yeah. So it's four things he said that they're mixing together.
It's a humongous process.
Yeah, it's a humongous process, and they have a sound engineer who's doing it. All right, for those of you who've never seen this, do you see that glass thing at the top at 12 o'clock moving around? That's the laser fiber. That's what I'm moving around to clean up the annular tear. It's called the debridement, as well as remove the herniation. I'm pretty much done. I'm going to move on to the next disc. I'm just going to clean this last bit right here. And by the way, we tested this disc, and it was 8 over 10, 8 out of 10 pain. So that's severe pain. The patient had severe pain here. And more importantly, he said it's the kind of pain he gets every day. So we call that concordant. So it's concordant severe pain at L2-3, which is good news. I like to see that result. That means my surgery is going to work. All right. Done here. We're going to take this out, and we're going to move on to the next disc, and hopefully that will go smoothly, and then we'll be done. Now remember, this next disc is special. We're actually going into a disc where he already has an artificial disc. Now the only way to do that in the world is what I'm doing right now. Transforaminal with one scope and one little tube. It's not possible to do any other way. So this is the only way we can go in and fix what's wrong in that disc. And by the way, the surgeon who did his surgery, I don't know the name of the surgeon. I'm not here to badmouth anybody. I promise you, what I'm here to badmouth is the procedure. Artificial disc surgery, I stopped doing it almost immediately back in early 2000. It was FDA approved in the United States around 2000, 2001. We were one of the test sites at University of Florida in Gainesville because we had a top neurosurgery program. And the truth is that the results were bad from the beginning, and everybody knew it. But the companies that sell these artificial discs hide those bad results from the public. And they hide them from surgeons, by the way, not just the public, okay? We would go to meetings, and they would lie about the results to everybody there, all the doctors. That's when I realized how much of an impact these companies that try to sell their devices to put in patients' spines, how much of an impact they had on the scientific agenda was they literally were blacklisting surgeons who were telling the truth about artificial discs and the complications that were happening. You should have seen the heated discussions that were happening at these meetings back in early 2000s. The surgeons that had complications from artificial discs were calling out the companies and the surgeons who were advocating for them, the ones who own shares, and they were basically bringing to light all the complications of these artificial discs. And they were making people aware of it, but the companies basically heard that, and they shut those surgeons down. They stopped inviting them. They stopped the meetings. They took control of the scientific agenda for all the neurosurgical meetings and orthopedic meetings. And now by donating millions of dollars to the meetings, they have instilled their people into the meeting leadership, so that all of our national meetings now are totally controlled by the industry that's selling implants, okay? So you can't believe anything anymore that they're telling you. Our meetings went from true scientific meetings where you can go and learn the truth as a surgeon, like how to better treat your patient, to basically just, what do you call it? Commercialization and promotion of expensive, dangerous technologies like these artificial discs, okay? These companies have also taken control of reimbursement, so where they're getting good reimbursement for surgeons when their surgeons are basically getting rewarded for putting dangerous metal in people that is dangerous for the patient. All this is happening today, and it's getting worse, by the way. So yes, the movie is exposing all that. I was part of that system for years. I didn't get much money at all out of it. I actually helped develop a implant for the cervical spine for a company I won't mention because I can't disclose it, but I did that to improve the system. So I was part of that group in a very limited way once, and I learned how it works. So I'm speaking as an insider. But you guys, you patients are all screwed because the doctors are basically controlled by these companies, and they're told to put all these implants in. All right, so we're right behind the artificial disc. Shot. Let's get an AP view. Now I got to be careful because I don't want to dislodge this thing, but I do want to get in as close as I can so I can remove as much of this garbage that's in there as I can. You can see my dilator is right between the Oreo, right in the cream of the Oreo cookie, so to speak. So I think I could go a little bit more safely, and I want to get as much of this residual herniation that's there out. Okay, remember, this patient had an artificial disc put in from the front. Where's the front, Jordan? That's the front, okay? And when they put it in, they left some disc herniation or disc material in the back because they can't see back there from the front. They can't see through the belly to the back. And it's a very common problem. So they left disc material back there, shot, and that disc material is now, take it out, pushing on the patient's nerves, causing leg pain. All right, I am right up against that metal. Yep, let's go in. We're going to do our best here. Wait, let me have it. Shot. I got to get my tube down so I can see the residual herniation and scar tissue around it. Let me have it. Shot. All right, so as I drive my tube towards the area that we need to operate on, are we okay on the heart rate's good? All right, shot. Let's all keep an eye on that. Any more questions, shot?
Yes, we have a couple more questions. Next one coming from Mike on YouTube, asking, this patient has a fusion as well at the L5-S1. How do they have a herniation at a disc replacement?
Yeah, I just explained it, Mike, because the surgeon never took all the disc out like they were supposed to. It's very hard to do, by the way, because you can't see in the back of the disc that well. But they still put the artificial disc in, even though they didn't take all the disc material out. That's what I'm talking about. When I badmouth artificial disc, I'm not badmouthing a technology that makes sense on paper. What I'm badmouthing is the result, the end result. Hold the tube in place. Pressing down. All right. I'm talking about not a surgeon, but I'm talking about the treatment as being bad, because there's a high chance of complications like this, a high chance of failure like this. That's what we're dealing with. A failed procedure. You understand? This is a failed procedure. Laser? Yeah, it is. Oh, sorry. So there's a high failure rate for these procedures because in practicality, they don't work, okay? When you look at them on paper, they sound great. You know, people are sold on the idea, oh, an artificial disc, take the bad disc out, put a new one in. It's great. But it's not great because they fail. They pop out, they get loose, the people still have pain, and like this patient, they still have herniation because the surgeon didn't do the surgery right. I'm not bashing the surgeon. I'm bashing the whole treatment. The treatment is unnecessary, it's invasive, it's dangerous, and it leads to complications. One of the complications we're seeing today is adjacent segment disease. So L3-4 is where the artificial disc is. The adjacent segment disease is at L2-3, right? So why does an artificial disc cause adjacent segment disease? The whole premise of putting artificial discs in was to avoid adjacent segment disease. You following me? So if we're supposed to be avoiding adjacent segment disease with artificial discs, why are we getting adjacent segment disease? The answer is because people still get adjacent segment disease, and the whole industry has lied to us the whole time just to get us to put these things in. So they're lying to the patient saying you won't get adjacent segment disease because you're getting an artificial disc, you're preserving movement, you don't have the same problems as fusion. So they took the business away from fusion to give it to themselves. In the meantime, they still have the same problems that fusion does. Scar tissue, complications, repeat surgeries, additional treatments needed, pain management needed, injections needed, all kinds of problems, right? But they lied to the public saying that this is a better treatment, but it's not a better treatment. That's the whole point. And it's the industry that lied, along with a bunch of surgeons and engineers and scientists. So what are we doing at Deuk Spine? We're shedding the truth. This is surgery on the artificial disc level, but we just finished the adjacent segment disease level. And it turns out that people who get artificial discs, they have just as much adjacent segment disease as people who have fusion, okay? I am not advocating fusion, but I'm telling you the truth. It's a fact. They've shown in studies now that artificial disc patients have the same rate of adjacent segment disease as patients with fusion. So then, if the whole point of the artificial disc was to prevent adjacent segment disease, then what's the point of having it done if the adjacent segment disease rate is the same? There's the metal right there. You guys see it?
Yes, we do.
It's literally right there, okay? I'll open things up. This is all scar tissue. You can see the metal. I'll show it to you in a moment. Right there. You guys see it? It's
Yes, we
literally
do.
right there. That is the metal disc right there, okay? And this stuff behind the disc is what we had to remove. So far, we're doing a damn good job. Most of it's scar tissue, but a lot of it's herniation, the blue stuff. So we're getting rid of both. So you are watching probably the first in the world. We've done this before, though, so it's the first for you, not the first for us, where somebody gets an artificial disc put in their back. They have a complication from it, which is there's a herniation behind it. Okay, look it up. It happens a lot. And we're going in now endoscopically with a uniportal transforaminal approach, and we're zapping away the herniation behind the artificial disc, so the patient's leg symptoms will go away. He also had back pain. He has back pain from here and leg. So we're fixing his back pain and his leg symptoms both. Make sense?
Yes, sir.
All right. Any other questions?
Yes, we have about 2 questions coming from. First one coming from Lanu on YouTube,
Hello, Lanu. Nice
Ask-
to hear from you.
asking, "Do you fix knee pain? Just curious."
Yes, we do. We have a new technology that's been patented called Deuk plasma rhizotomy, where we can cure arthritic knee pain or knee pain from a meniscal tear. So if you have arthritis in your knee, do not get a knee replacement. Come to Deuk Spine. Most likely, we can go in and get rid of the pain without doing open surgery, without putting metal in your knee. The days of metal are going away, folks. Deuk Spine is leading it. All right, there's the artificial disc. We're seeing the back of it. The laser is very powerful. By the way, the laser melted that metal right there. You guys see that? Pretty cool.
Yes, we do.
Now, some of you may say, isn't that bad? But if you understand the scale, that laser fiber is 1 millimeter. So that blast in the metal is quite literally about, 5.5 millimeters, half a millimeter. It's very tiny. It doesn't affect the performance at all. But that shows you just how powerful the laser really is. All right, so in here is the core, is going to be the core of this disc. There should be a second half of metal over there that we're going to see in a moment. But I'm removing as much of this herniation. This blue stuff is the herniation. I just want to be careful not to compromise the core of the artificial disc, which is the plasticky stuff in between the metal. It's going to be right below this, okay? So I'm going to be very careful. You can see the laser is able to shave away literally sub-millimeter amounts of tissue very precisely under the guidance of the endoscope. This is the most advanced surgery in the world. There's the other half of metal right there. You guys see it?
Yes, we
Right
do.
below my laser there. And this is just inside the metal. There it is. Okay? So this is a failed artificial disc, failed technique of putting it in, and failed disc. You can actually see there's the rubbery part in the middle, between the metal, and there's a bunch of herniation stuck to it that they never took out. They should have taken all this out. They didn't. But it's not the surgeon's fault, really. I mean, it is sloppy surgery. It's just a problem that happens a lot with these artificial discs. And they don't talk about it because they don't want you to know. They don't want you to stop getting these things put in. So they shut surgeons down. They take away their voice so they can't tell you about this, okay? If you try to get a paper published today on how these artificial discs fail, the journals will not publish it because they're controlled by the industry, by the companies that make these. They will literally deny your publication. Not because it does not scientifically valid, they'll deny it because they don't want bad press. They don't want people to stop putting these devices in. They spent $500 million buying the companies that make these things, and they don't want, a few measly complicated patients to interrupt their flow of revenue. That's really what it's about. And that's why Deuk Spine is here, because nobody controls my voice but me and maybe my wife. But the fact is, I'm your voice. I'm the voice of the public. I'm the voice of the patients. I'm here to tell you guys the truth so you guys can know the truth so you stop hurting yourselves by selecting bad surgeries like artificial disc, fusions, laminectomies, microdiscectomies, and so forth. We're just about done. I need 30 seconds to a minute just to blast some more scar tissue, and we'll be done. All right, any questions?
Yes, this next question is coming from Steve on YouTube,
Hi, Stephen.
asking, would you describe your approach for DLDR compared to others who take transforaminal approach and drill some bone to, quote, open a window?
Yeah, I'm not going to compare my approach to everybody else. You can read or watch my approach. Other doctors do things their way, and what you're asking me to do is compare my treatment to maybe, I don't know. I mean, there's doctors doing endoscopic surgery in China, India, other countries all over the world. So I can't comment on what they're doing because I don't watch all their surgeries. But the standard treatment that they're doing, if they're removing bone, they're removing part of the facet joint. I don't think it's necessary. It creates bleeding and scar tissue and pain. This treatment I'm doing is the very best you can do. There's nothing better. I've tried other treatments. They don't work as well. But I can't tell you what every doctor does. I don't know what every doctor does. It's impossible to know. There's no standard, unfortunately, there's no standard way of doing anything. If you ask me, compare your fusion to other doctors, I do a fusion a certain way, but they do it different. Everybody does it different. Okay, that's the problem, is everybody does it different. And the way I do it today is not the same way I was taught to do it as a resident. In other words, I've modified the way I do it to make it better. And frankly, my fusion today is the best, in my opinion, the best way any fusion can be done. But if you do the same fusion, the same L5S1 fusion, there's literally 50 different ways to do it. So if you're asking me how do the other doctors do it, I'd have to describe 50 different variations, which I'm not really prepared to do. All I can say is you want the best, you come to Deuk Spine and get ours. All right, we're done here. We're going to leave this artificial disc alone. We've gotten rid of what was behind it, mostly scar tissue and herniation that caused the scar tissue. But we got to see both the top and the bottom metal plates, and we got to remove the herniation behind it. And I think our patient's going to be much happier. We're going to end the stream in a moment. We'll take whatever remaining questions you have. We will be back in 5 minutes with our next stream, which will be the treatment of his painful facet joints.
At this moment, no current questions.
All right, let's end the stream and come back for his lumbar Deuk plasma rhizotomy L2 to S1 by